We are here. ¿Cómo están? On my end, just feeling a little tired. I have a few things to work on for my dissertation, but excited to be here, excited to be recording with you all. Miriam, how are you?
I am very glad to be here. We're very glad to have you again with us. And today we have a very special guest. We have a very special topic to discuss. So I'll let her introduce herself.
Hi, I'm Christine Zimmerly, and I'm a woman in long-term recovery from substance use disorder. And I'm here to talk about the work we do at Proyecto Sanaremos in the Northeast El Paso, which is a part of the El Paso Recovery Alliance.
Thank you so much for being here, Christine. And just so that we can get our conversation started, why did you choose this line of work? And, what have been some of those moments where you have felt like this is the place where I'm meant to be?
Thank you so much for having me. And, I think when I heard about recovery support services, it was something that I heard that it was a calling for me. And I had been in recovery for a few years, and I heard that I could help people like myself, who were struggling with substance use disorder, who were on the street, who didn't know where to go, that I could work at a center where there was 24-hour support for people with substance use disorders. And to me, that was just, it was like a calling.
Thank you so much for sharing that and being so vulnerable with us about, this type of work. I think it takes a lot. I want to learn more about, that experience of being in practice and understanding the needs of those in the community, serving the El Paso community specifically. What have been those experiences for you?
Well, peer support is a special line of work because we have lived experience as peers with the challenges that the people we are serving are facing. And there's something that is so comforting about the authenticity of the profession. When someone comes in the room for a conversation, and we have recovery support services in our centers and also in our recovery living spaces that are offered weekly or bi-weekly or monthly, whatever the person, because it's person-centered, would like to receive. When they walk in the room to have a conversation, they know they're walking in to speak with someone that understands the pain.
Yeah. And so I think what I hear from you is, when these individuals come to this space, they just want to be able to have that kind of connection and find that support. In there, you mentioned kind of person-based or person-centered. Can you expand on that idea? What is that? What does it mean?
Person-centered is focusing on the needs of the person that you're working with. It's I'm not going to give a directive to anyone. I might offer some suggestions if a question is asked, but most of the people that we work with have within them their own goals, and no one is more of an expert on anyone than themselves. So what am I willing to do? What would I like to achieve? And how am I going to get there? Those are things that if I have a conversation, and typically we use motivational interviewing in conversations with someone, they'll be able to answer for themselves. And when the answer comes from the person you're talking with, it's a lot more powerful than when you give it to them.
Yeah, I agree. And I think that, coming to a place where you want to be of support rather than telling a person what, they need, is very empowering for that individual coming for that support. And I think that's where that peer support comes in, right? You're not necessarily telling them, I know what is best for you, but I'm here to lend you a hand so that we can walk together in this journey. Am I on the right track?
Absolutely.
In this work, how long have you been doing this type of work?
I have been working for Project Punto de Partida since June of 2019 when the center at 1201 Yandel opened.
So a couple of years already. Can you tell us a little bit more about what are the experiences that you've had serving the community of El Paso? Like, what are the needs that you've seen that you as a peer recovery have, helped address because of the work that you do, because of the level of accompanying people in this journey?
All kinds of different things. We do outreach where we go onto the street or to community organizations to talk about the kind of work that we do. We do in-reach, which is in jail. So we'll go into the jail and offer recovery support services to people in the jail. And we offer services within our center. And then we have recovery housing, medication-assisted treatment program, a women's house, a men's house, a facility that extends past that, that's sober living. And I don't think there's really a limit to the need. There's a greater need within our community than we can possibly serve at this time. We have people waiting every day to get a bed at a detox center. And detox is necessary for certain types of substances before you can go into the recovery house. We have a waiting list at the recovery houses. There isn't enough space in the recovery houses for the people who need to receive the services. And there aren't enough beds at the detox center. If someone has insurance, you can typically find a bed somewhere for detox. Most of the people we serve don't have insurance. Most of them are unhomed, on the street, with no identification, and some of them are not even citizens. So we do what we can to offer help to people who are not receiving services at all and don't qualify for programs in other areas.
So the work that you do really does serve like one of the most vulnerable populations that we have here in El Paso, those that really don't have other ways of accessing these type of services. What are some of the experiences that you've had sharing or doing this work in the community that you would like to share with us?
I have personally seen successes, and I've seen areas for improvement. So some successes would be like the example of someone coming into the center and from the street and getting connected with services. We do provide, referrals, warm handoffs. We'll go with someone to the appointments if they don't want to go by themselves, getting them identification, putting them in a house, seeing them get housing, and seeing them get a job or work, and get into their own rhythm of things where they're no longer using substances and active in recovery community and have found their pathway where they're living a healthier lifestyle. I've seen that many times. And I've also seen staff be overworked, not enough hours to reach out to people. The person coming in not having access to a telephone and getting lost on the street and not being able to reach them for their appointment with housing because they're on the street and we are unable to communicate with them. I've seen the facility close because of illness, because we've had so many people sick. Of course, I think we've all seen that within recent years. And, you know, I've seen so many different things. The biggest successes are wonderful to watch, and the places where I see that we could stand to improve, not only as an organization but as a community, are like when I've seen participants die from fentanyl overdose, when I've seen someone not come back and walk in off the street 6 months later and not even recognize anyone in the building, even though we all know their name. But it takes us like 15 minutes to recognize them because they've changed so much from the weathering and the conditions on the street. That's a lot.
That is
It's a lot.
It is a lot. And I think with it being a lot, I think it's still important to talk about it and to understand the severity of this kind of topic. So again, thank you so much for speaking about it and coming and letting us know a little bit more about this area. And I think, you know, it takes a lot of resiliency, a lot of empathy and compassion to be able to work in this kind of field, because it's the ability to bounce back, right? The ability to be able to move forward, understand that there's a lot of systemic issues that contribute to this issue, but this issue is then reflected in the lives of these people, right? So we can talk about policies, we can talk about practices, we can talk about all these different things, but at the end of the day, it's the lives of people who are affected. And I'm curious to know, you know, how does someone who may be experiencing or have a loved one who is going through substance use, what would you say to them in terms of supporting them or helping them or helping themselves? Like, whatever perspective you want to take, right? Because you could definitely take it different ways. What would you say to this person? Because as you mentioned, we are a community. So as a community, how can we help each other out?
So for families of those with substance use disorder that are actively using, we do have family support. And we offer that whether or not the family member is receiving services. It's just a community service that we provide for anyone who needs that support. For individuals, get a recovery coach. Harm reduction saves lives. Come in for a bag of food and we'll talk to you. It doesn't have to go further than that, but we can offer an ear to listen and possibly more support than that if anyone is willing to accept the help. And the help we give, we have harm reduction supplies. We have, I mentioned the food bags. We also have Narcan, which is the opioid overdose medication that we can give to people who need it. We have wound care kits, feminine hygiene kits, bleach kits, and safer sex kits. We give these out to anyone who comes in and asks for them at no charge. Anytime they ask, we don't require anything in return. We will ask if you sign in, but we'll still give it to you if you're unwilling to sign in. So please come by.
In talking about the types of services that you provide and how can someone, start, a conversation or just, access to your services. You mentioned harm reduction. And then you gave, several examples maybe about what harm reduction looks like, safer sex, first aid kit. Can you explain a little bit more about what harm reduction is? How does it look in the work that you do?
Harm reduction is meeting people where they are at. It's no expectations. I recognize that someone on the street might like a glass of water and a meal, and if that's all they want, that's what I'll give to them. Harm reduction doesn't make requirements. We just want people to stay alive because your lives matter.
I think these go back to the discussion that we had previously about people-centered. When you look at the person with, the autonomy, the dignity that they have, and you say, I'm here for you to walk with you. You tell me what you need. You tell me what are the answers that you're looking for. Then harm reduction makes a lot of sense as a framework for work.
There are so many pathways to change, and reducing the harm that's being caused is a really great first step for every change if unhealthy behaviors are involved.
I think one thing that stood out to me right now is the fact that you said that change can have many different phases, right? Many different interpretations. And that leaves room for something like hope, right? That doesn't have to be this straight trajectory of, okay, I know that I may need help and I'm going to go get help. From point A to point B, there's so many things that could happen there. Or there could be so many ways of getting to that help. And it's okay to have all these trajectories, just as long as you are hopeful and you have the resiliency to move forward, right? And to get the help that is needed. And I keep on going back to that person-centered, but I go back to it because I think it's important as a community, again, to practice that empathy and that kindness to everyone. And so I want to bring to the table the idea of first-person language. Get your thoughts on it. Is it important? Is this a way to, in a way, help individuals humanize their experience? Would you push back when describing someone as a drug addict, right? Or rather saying something different, right? You reacted to that because that's not first-person language, right? So I want to hear about it. I want to hear from you and talk about it. Why is it important to adopt it?
A person who uses substances is still a person first. Mm-hmm. That's all. Mm-hmm. It's not about the substance. And I think a lot of stigmatizing behaviors and language make it about the substance or even the behavior that's caused by the substance use. It's a disease, and the person who is suffering, as much as whatever damage they may cause in their addiction to others, is also suffering and damaging themselves as much. Mm-hmm. And they're worthy of help.
Mm-hmm. I agree, and I think this is why it's so important, because I think people go on in life, not everyone, and it's not necessarily always done on purpose, but they just kind of say it without understanding the impact it can have on an individual. And talking about first-person language is, this person is a person. They have feelings, they have experience, they have loved ones. And I think it's important to know that our words can make a difference in the lives of people, and that the way we approach individuals is important. And so instead of using such a phrase like I used previously, it's someone that is experiencing some substance use. Is that would that be the most appropriate way of saying it, or how would you?
A person who uses substances, a person who experiences substance use disorder. It's always person first. It's just it's because it's about the person. And drug addict, it makes it about the drug.
Yeah. And that's already enough to know, right? The difference. So just so that we can continue adopting these things, right? And understanding that a simple switch to our language can make a big difference.
Very true.
I think it reinforces what you have been mentioning, Ale, previously, that compassion, that, recognizing the humanity in others and like the journey of others and the pain and the experiences, the lived experiences that they've had when you recognize the person before anything else, because everything else talks about their experience of life, but that is, what happened to that person, not necessarily what defines them entirely or what their identity is reduced to. It also, I think, brings a space for, a safe space that maybe, you can, by being mindful and by being very conscious of how we express ourselves and how we talk about people with substance use disorders, we can generate a level of safe space where they can maybe feel comfortable and, accepting that glass of water or, walking in and accepting services or requesting services, whatever it is that they're looking for or that they need at that moment.
I think the connection and the conversation and just of meeting someone where they are when they walk through the door is, the most important thing. And there's just so much pain and there's so much harm and there's so much stigma around incarceration, formerly incarcerated, substance use, even sex work. There's just so much harm in the word. And what we want to do is help. We just want to, if we're alive, we still have a chance. And so our goal as a harm reduction center and recovery support center is to keep people alive and to help them to see what it is they would like to change, if anything, if possible. Yeah, so hopefully we're helping.
I'm sure you are.
I think you definitely are, Christine. And I know I've said this before, Christine, but honestly, thank you. Thank you so much. You can tell that this is a really meaningful work. And I think it's not even necessarily just a work, but like you said, a calling. And it has both personal and professional influences in you. It is a topic that can be heavy, but that doesn't mean it shouldn't be talked about. And that doesn't mean that what you're talking about should be hidden because it's heavy. On the other hand, these are experiences that should be highlighted. Go on, sorry.
I was just thinking about, talking about it. And in my office, we were discussing that the other day. I'm grateful because when I was in active addiction, a peer came to me and helped me. Mm-hmm. And through 27 years of active addiction, I wasn't able to make a change.
Yeah.
Because of that, I'm where I am today, which I get
It's okay.
Yeah, it's really close to my heart, right?
Yeah.
This is my lived experience.
Mm-hmm.
I mean, I am a state certified peer recovery support specialist, a peer specialist supervisor, a reentry specialist. I'm certified through the state. I am able to function and complete sentences today, and that's something that I never thought really I would be able to do again. If I can sit with anyone and tell them just even a little of my story, and it gives them a little bit of hope, I'm going to do it. But too many people are too afraid to come forward. They're too afraid to say, I am that guy. I am that homeless person. I am that incarcerated person. I am that person struggling on the street. And that isn't me today, but I was that person. And if no one gave me a chance, I would not ever have been able to get to the position I'm in today. So I encourage anyone to speak out. Anyone who is willing to speak out. And if you are out there and you need help, please come forward. That's what I say to people. Please come forward. Because you're not alone. You don't have to walk it alone. And that's it, I guess. Yeah.
We're so grateful for you. We're so grateful that you're here and that you shared all of your experience with us. I think we're all better because of it.
And I think, do you want your hand back? If you want it back, I can give it to you. I can I think you don't have control of, unfortunately, right? You would like to have control of everyone being able to go get help and get the necessary resources and, because it works, right? It works. I just hope that you know that all the things that you are doing is enough. All the things, all the experiences, you because you're Christine. Not you because you do all these things, but just simply because you're Christine. And you care and you love and you experience and you learn, right? And it's a hard pill to swallow, those experiences that other people go through, because you just kind of want to blanket them and just say it's going to be okay. And that's because of the kind of human that you are. I just want you to know that what you do is enough. What you do matters. What you do is impactful. And the fact that you're coming here and talking about it to us, two strangers that you just met like 30 minutes ago, right? It just speaks of that vulnerability and that transparency that you want to give to not just us in this room, but everyone else. And it just takes a little bit of that courage to be able to then start. It's like a little domino effect, right? It's a little domino effect that will create ripples of meaningful change. And I guess I'm wondering, like, before coming here, what were you thinking that this process was going to be like?
I didn't have any idea.
Yeah, go ahead.
I didn't have any idea. I thought maybe I should have looked into it more, but it's okay.
Right? That's what I'm saying. You end up coming here and you talk, and is there something that we possibly haven't spoken about that you would like to highlight?
We need more Narcan. We need more people to have more Narcan. It's, life-saving opioid overdose reversal medication. If you don't know how to use it, I'll give you a training. We do train in our center, but we need more. We don't have enough right now, and people are dying. Children and people who make one choice, and people who have been addicted for years because there's fentanyl and now carfentanil in our area, and heroin and other drugs. It will reverse an opioid overdose, and we don't have enough. Our phone number is 915-262-0002.
We'll put that in there. Yeah.
That's our phone number. Referrals at recoveryalliance.net. Send us referrals.
Yes.
Well, we just, we need more Narcan. We are working on getting more sources for that. Mm-hmm. We do have some grant funding for it, but it's very expensive medication, and it can save a life. And most of the people who administer it are people on the street like you and me, and someone who happens to be in the room. An overdose happens very quickly, a death from an overdose very quickly after that. And so don't use alone if you're using, and have Narcan with you in your pairs or in your groups.
You mentioned training. Mm-hmm. Can anyone be trained?
Absolutely.
What does that entail, that training?
It entails either 2 or 4 hours of your time and willingness to either arrive on a Zoom meeting. I could train somebody on Zoom, or in the center for the training.
Perfect.
Yeah. Before we leave, I just want to highlight just how the difference in the way I see you right now, the way you carry. Right now, when you came in, you didn't know what to expect, right? And after this conversation, the giggles, right?
Oh, yeah.
And now, having heard about what you do, and you sorry, I can't speak today. Just being able to talk, I see a difference, and I see, that confidence that I know you carry with yourself. And you're getting the giggles again, Christine. I just see the difference, and I think that's important to note. Thank you so much for coming. Really appreciate it. This is, again, a very important topic to cover, and it's not just anyone can do this. And so I think you were the perfect person to come into this space and share with us your experience, both personally and professionally.
I agree. Thank you so much for giving us a chance. Even though it was unknown and you were, really not sure what to expect. But you have been a wonderful guest. You have provided us with wonderful information. And, we hope to see you again, maybe.
Did we not do a good job, Christine? Just kidding. So for you to say yes,
great
absolutely.
job. Come on.
Yes.
Absolutely. Also, come by and see me. My office is at 8500 Dyer, Suite 34.
Yes. Thank you so much for that, all of that information. And for those of you who are, seeing us, just a reminder to just simply be kind be kind, be empathetic, be there of support, no judgment, first person language. I am a strong advocate for it. Just describe the person, right? Like see the person and instead of judging the behavior. That goes a long way. But thank you so much for listening. Thank you so much for sharing some of your time with us. Maybe I'm not too sure if you have some parting messages.
Thank you for staying, and I hope that you took something from this conversation. I'm sure you did. We hope to see you in this next episode, and thanks again.
See ya.
Thank you.